Hey guys, this is Shane Holcomb. I'm a registered nurse with Pruitt Health Hospice, and I wanted to take a minute and tell y'all about something that I get told almost every single day. Somebody always says to me, "Hey Shane, hospice sounds fine, but we're just not ready to give up on our grandma or our mom." Well, I just want to tell you guys that you're not really giving up on a patient by placing him on hospice. You're actually doing the best thing that you possibly could, because when they come on hospice, you're really able to tap into a lot of resources that you weren't able to tap into before, like a registered nurse who'll come out to your house to make visits and manage your medications, manage your disease process, manage your symptoms. You're able to tap into a CNA, who's a certified nursing assistant. They will actually be able to come out and do things like bed baths or showers, brushing teeth, combing hair, all that personal hygiene stuff that's really, kind of hard to do. Our people can step in and kind of take some of that load off of you. We're also able to let you tap into a chaplaincy service or social worker service if you need spiritual or social support. We have a group of volunteers who come out to the house and do companionship visits with patients to give them some extra social time. They do things like, read a book, read newspapers, play music, various other things. And then last but not least, in our team, we have a medical director who is fantastic. She is Dr. Davis from the Longstreet Clinic down in Gainesville, and she acts as, our medical director, which means that she oversees the medical care of all of the patients on hospice in conjunction with the primary care physician who originally did the referral. So those two work together to, assure that the needs of the patient are met, and she's fantastic. Hospice, again, doesn't mean giving up on the patient. It means that you're trying to do every single thing that you can to get the services that you need to help the patient have a comfortable, life. If we're talking about, quality, over quantity, I'll take quality any day. We might not be able to do anything curative for the patient, but we certainly can give a lot of supportive care. And then at the end, when the patient is transitioning, we step in and we can start comfort care, which is, I think, something that everybody would want. Nobody wants to suffer or to, feel like that their family members suffered, towards the end of life. So hospice is a fantastic thing, and, I really do hope that this video will kind of educate, some of the people out there about what we really do. It definitely does not mean you're giving up on the patient, because we don't come in and do anything at all to take away from the patient. We don't shorten their lifespan any. As a matter of fact, some studies have shown that we actually, when we step in and start managing care for the patient, that we can get a lot of the patients some extra time that they probably wouldn't have had they not had a nurse coming into the house to do the managed care. So definitely, if you feel like you have a loved one who might qualify for the service, if we've lost a lot of weight, or if the patient's just not eating like they should, give me a call. I'll come to your house, or I'll talk to you on the phone, and we'll go over the medical records together, and we'll see if it's time for hospice or if it's time for some other avenue, which I can help you explore. I've been doing this a long time, and I know how to navigate the system pretty well. So again, Shane Holcomb, Pruitt Health Hospice. We cover all these Northeast Georgia counties. Matter of fact, we cover almost every county in Georgia, and I can certainly help you get your loved one on if it's an appropriate thing to do. And I love talking, so call me and we'll chat a little while. My number is 706-340-3259. Thanks a lot. Bye-bye.